Hi everybody, welcome to Labor and Delivery. This is a three-part series in the first internet module on intrapartum care. Welcome, my name is Cindy Castaldi and I will be teaching this. So an overview of the process. Mom, when in the world will you be finished downloading that baby? So there's some things that help to contribute to labor starting. There's maternal factors and there are also fetal factors. So the maternal factors are the uterus muscle is being stretched. Stretching of the uterus muscle releases prostaglandins. There's pressure on the cervix, which releases oxytocin. As the uterus stretches, oxytocin levels rise, and there's an increase in estrogen. And when there's an increase in estrogen, it changes the relationship of progesterone, and progesterone is basically withdrawn. Remember, progesterone is what helped to maintain pregnancy because it is a smooth muscle relaxer. Therefore, it was relaxing the smooth muscle of the uterus. The fetal factors are that we have a placenta that's getting old. It's beginning to deteriorate because it really has a life expectancy of about 40 weeks or 9 months, and after that it says pretty much done doing my job, time to move on. There is an increase in fetal cortisol, which also reduces progesterone, which is that smooth muscle relaxer, and prostaglandins are released and stimulate contractions. So those are a bunch of things that are going on that are important to understand. So the process of labor, the woman's body is preparing for labor in the onset. So some of the things you'll see is lightning, which can happen anywhere between 2 to 3 weeks or even earlier prior to delivery. Nesting, getting ready for the baby to be born, cleaning the house, making the baby's room okay, and that's 1 to 2 days before labor. Loss of a mucus plug, that can happen hours or days before labor, but remember, it does not mean she's in true labor. But it's something that she would want to notify her physician about, along with if her membrane's ruptured, like what happened here in this picture, because we want to make sure that there's no infection or anything else going on. And she could possibly have some flu-like symptoms. Not often, it's pretty rare. So there are things called the 4 P's that affect labor. So we have the passageway, which is how the baby gets delivered, the whole process of it going from the uterus through the cervix, through the vagina, and then delivered. The passenger is the baby, the powers are the contractions, and the psyche is how is that woman feeling. So I just want you to remember, as far as the powers go, that the top part of the uterus, the fundal part of the uterus, is what is doing the contracting. The bottom part, the cervix of the part of the uterus, is what is thinning and dilating. So those two things are happening in conjunction with one another. So we're going to take a look at the fetus. So there's a few things. We're going to look at the presentation, the lie, the attitude, position, station, and engagement. And what is that baby like? So the presentation, is the baby in a head first position, also known as cephalic, which is the position we want the baby to be in? Is the baby in a breech, or buttocks or feet first position? Or is the baby in a transverse position, so which is shoulder first? So it's either head first, butt first, or shoulder first. Delivered in a transverse lie is always by C-section. Breech many times by C-section, just due to the potential for some serious complications if delivered vaginally. Then you have the attitude of the baby, and if you think of attitude, you want to think of the baby's position to itself. So if you took your hands and you put them on your hips, you would be in some kind of attitude, right? So the baby's attitude is how that baby's hands and feet and legs are in position to its trunk, basically. So the position we want the baby to be in is a complete flex position. Makes for a very simple and easy delivery. Fully extended position can cause a lot of problems. As you can see, it's the face is showing, a lot of bruising, a lot of complications can happen. So again, we want that baby to be in a flexed position. There are various types of presentations listed here, but what we're looking at mainly is the flexion or the extension of the baby in relation to attitude. Just a picture of a face presentation with the baby sticking its tongue out at us. The fetal lie. So there's two lies. There's a longitudinal or there's a transverse. So the longitudinal is the vertex position, head down, butt position or breech, both longitudinal to the mom. The other is transverse, sidewards to the mom. Remember, never delivered vaginally. When you talk about fetal position, we're looking at the relation of right here, the occiput to the mom's pelvis. So that's the head to the pelvis, but it certainly can be something else in relation to the mom's pelvis. So the first letter is the presenting part is either right or left to the mom's pelvis. The second is the presenting part. What is it? The head, the butt, the shoulder. The third is the presenting part, either anterior or posterior to the mom's pelvis. This will all make a little more sense as we continue through the various presentations. However, what I want you to know is the majority of babies are born LOA, left occipitate anterior. So we'll take a look at the fetal skull, and if you think that we want that mom to be 10 centimeters dilated and we look at the diameter of the baby's skull, it's only 9.5. It makes sense how the skull, a normal sized skull, can actually fit through that birthing canal. However, in addition to that, there are fontanelles, which are what the examiner will feel to determine the position of the baby's head. And there's also sutures, and these sutures through the delivery process will cross over each other to actually even make that biparietal diameter even smaller. Here's just a picture of molding that happens, and then how it changes in about 24 hours. And that happens just through the entire, as you can see here, process of delivery. These sutures override each other, they go on top of each other, and then there's that head molds as it goes through. It gets thinner as it goes through the birth canal of the vagina. So when we look at the passageway, we're looking at the pelvis, and we're also looking at the soft tissue of the cervix. So the pelvis, there's the false pelvis, which is the shallow upper portion of the pelvis. The true pelvis is the lower part, and it has three planes, which consist of the inlet, the mid-pelvis, and the outlet. So the measurement of these three planes helps to define how well the pelvis can handle the delivery of the baby. Important to know. And then there's the station, which is the relation of the ischial spines to the presenting part of the fetus. Helps to determine where the fetus is during the descent during labor. So the bony pelvis, we'll get back into effacement and dilation that I did skip over there. There's different types of, and that's why this helps to determine how well the baby's going to fit through. The gynecoid is the most common, and the platyploid is the least common. And as you can see, it has a pretty wide opening, so that would mean a pretty easy delivery process, as well as the gynecoid. But the android and the anthropoid have pretty small openings here, which, and when a vaginal exam is happening, you can see that only 2 fingers are able to be inserted because of the small diameter. So the soft tissues of the pelvis, what we're looking at is we're looking at effacement, and that's the thinning and shortening of the cervix. So here it's measured in percentage, and here you can see it's 0% effaced, and here you can see 100% effaced. So look at the difference in the length and the thickness from 0 to 100. Big difference. And then when you look at dilation, you can see that it's 1 centimeter and it goes all the way up to 10. Again, a big difference. And remember, the biparietal diameter of the baby's head initially, before the sutures override, is only 9.5 generally. And here's just a view of the cervix. And here's just another picture to give you an idea of the change from 0% effaced, 0 centimeters dilated, all the way up to fully dilated and 100% effaced. So the pelvic station is the fetal descent. So what we're looking at is we're looking at what's called the ischial spine. So the ischial spine is here. So we're looking at, do you see this little gray thing? So we're looking at midway between there. When the baby is above midway, it is negative. So -1, -2, -3. Oftentimes -4, -5, the baby's sort of still floating in the uterus and it hasn't engaged yet. When the baby hits around 0, it is engaged. +1, +2, +3, the baby is moving down the birth canal. It's moving down that uterus into the cervix. What we want to see is we want to see +4, +5 tells us, along with 100% effaced and 10 centimeters dilated, that this baby is now ready to be delivered. So those are 3 important things. The fetal station measured at the ischial by the ischial spine at 0. The effacement, which we want to be 100%, and the dilation we want to be 10 centimeters. We need all 3 of those things to tell us that the baby's ready to be delivered. And just a little thing about the mucus plug is that we know it's the passageway from the vagina to the uterus. It helps protect the baby from infection. It helps to protect the uterus from developing any infection, which then in turn affects the baby. There's some tiny blood vessels, and it's obviously full of mucus because it's called a mucus plug. But the thing about that is that it, that was talked about during pregnancy, is that it really protects the baby and the uterus from infection. When the mucus plug comes out, again, please note that it does not mean the woman is in true labor. We need to know that she is effacing and dilating are the 2 things, and we'll talk more and more about that, but just keep that in the back of your mind. All right, so I hope you enjoyed this presentation. You can view this over and over and over and over again. I know I probably went pretty quickly. So just like I said, please take your time, review it again, and please don't hesitate to let me know if you have any questions.